This is the Lone Crater YouTube. We hope this video helps.
In this video, I will explain how to study pharmacology in physiotherapy. Start by grasping fundamental drug classifications and how they work within the body. It's crucial to connect drug actions directly to their impact on patient rehabilitation and exercise tolerance. Concentrate your efforts on the most frequently prescribed medications you'll encounter in your daily physiotherapy practice. This targeted approach ensures you build a practical and relevant knowledge base for your career. To study effectively, create detailed concept maps that visually link drug classes, their mechanisms, and physiological effects. Flashcards are excellent for quickly recalling specific drug names, typical dosages, and potential side effects. Integrate case studies into your routine to see how different medications interact in real patient scenarios, helping you understand their practical implications. This combination of visual, rote, and applied learning will solidify your understanding. Applying pharmacology clinically means connecting drug effects directly to your patient assessments and treatment strategies. Always consider how specific medications might impact a patient's exercise capacity, their pain perception, and overall recovery timelines. Don't hesitate to collaborate with doctors, nurses, and pharmacists to discuss drug management and its implications for your physiotherapy interventions. This integrated approach ensures comprehensive patient care. For ongoing learning, always refer to reputable pharmacology textbooks and trusted online databases to ensure your information is current and accurate. Actively participate in workshops and seminars to stay informed about new drug developments and evolving treatment guidelines. Remember, continuous learning is key in this dynamic field. Also, be sure to check the description below for a link to some fantastic socks with a lifetime warranty, plus other great deals.
Thanks for watching. Consider subscribing if we helped you.